How you doing? This is Eric Loyd. I'm going to go ahead and continue reading the rest of the book here, Medicare and You, the official U.S. government Medicare Handbook. I read section 1 previously, but I did not read the contents and the pages up to section 1, the index of topics, so I'll go ahead and do that now. Contents, Get Started is on page 4. What are the parts of Medicare is on page 5. Your Medicare Options, page 6. Original Medicare versus Medicare Advantage, that's page 7 through 8. Get the Most Out of Medicare, that's page 9. Index of Topics, page 10. Section 1 is Signing Up for Medicare, that's on page 15. Section 2, Finding Out if Medicare Covers Your Test, Service, or Item, that's page 25. Section 3, Original Medicare, that's on page 51. Section 4, Medicare Advantage Plans and Other Options, that's on page 55. Section 5, Medicare Supplement Insurance, Medigap Policies, that's on page 69. Section 6, Medicare Prescription Drug Coverage, Part D, that's page 73. Section 7, Get Help Paying Your Health and Prescription Drug Costs, that's on page 83. Section 8, Know Your Rights and Protect Yourself from Fraud, that's on page 89. Section 9, Get More Information, that's on page 101. Section 10, that's Definitions, on page 109. Section 11, Compare Health and Prescription Drug Plans in your area, that's page 113. Next page, page 4, Get Started. If you're new to Medicare, learn about your Medicare choices. There are two main ways to get your Medicare coverage: Original Medicare and Medicare Advantage. See the next few pages to learn more. Find out how and when you can sign up. If you don't have Medicare Part A or Part B, see Section 1, which starts on page 15. If you don't have Medicare Prescription Coverage Part D, see Section 6, which starts on page 73. There may be penalties if you don't sign up when you're first eligible. If you have other health insurance, please see pages 20 through 21 to find out how it works with Medicare. If you already have Medicare, you don't need to sign up for Medicare each year. However, you should review your Medicare health and prescription drug coverage and make changes if it no longer meets your needs, or if you could lower your out-of-pocket expenses. Mark your calendar with these important dates. This may be the only chance you have each year to make changes to your coverage. October 1st, this one says 2019. This is an older book. Start comparing your current coverage with other options. This book is for this year, 2020. So October 1st, 2019, I'm assuming that would be every year, on October 1st, you start comparing the current coverage with other options. You may be able to save money. Visit medicare.gov/plan-compare. October 15th through December 7th, 2019, change your Medicare, health, or prescription drug coverage for 2020 if you decide to. This includes returning to Original Medicare or joining a Medicare Advantage plan. January 1st, 2020. New coverage begins if you made a change. If you kept your existing coverage and your plan's costs or benefits changed, those changes will also start on this date, January 1st to March 31st, 2020. If you're in a Medicare Advantage plan, you can make a change to a different Medicare Advantage plan or switch back to Original Medicare and join a standalone Medicare prescription drug plan once during this time. Any changes you make will be effective the first of the month after the plan gets your request. See page 65. There's a star down here. It says pages 5 through 9 provide an overview of your Medicare options. Page 5, what are the parts of Medicare? Here's the meat and potatoes. Part A, hospital insurance, helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, home health care. See pages 25 through 28. Part B, medical insurance, helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment, many preventative services like screenings, shots or vaccines, and yearly wellness visits. See page 29 through 49. Part D, prescription drug coverage, helps cover cost of prescription drugs, including many recommended shots or vaccines. Part D plans are run by private insurance companies that follow rules set by Medicare. See pages 73 through 82 for that. Page 6, your Medicare options. When you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are two main ways to get Medicare. Original Medicare. Original Medicare includes Medicare Part A, hospital insurance, and Part B, medical insurance. If you want drug coverage, you can join a separate Part D plan. Usually, insurance agents remember Part D for drugs. To help pay your out-of-pocket costs in original Medicare, like your 20% coinsurance, you can also shop for and buy supplemental coverage. Can use any doctor or hospital that takes Medicare anywhere in the U.S., United States. Here's a little picture as well. That's all in the book, Medicare and You. It also says here you can also add supplemental coverage. Some examples include coverage from a Medicare supplement insurance, Medigap policy, or coverage from a former employer or union. See Section 3, which starts on page 51, to learn more about original Medicare. The next part here says Medicare Advantage, also known as Part C. Medicare Advantage is an all-in-one alternative to original Medicare. These bundled plans include Part A, Part B, and usually Part D. Plans may have lower out-of-pocket costs than original Medicare. In most cases, you need to use doctors who are in the plan's network. Most plans offer extra benefits that original Medicare doesn't cover, like vision, hearing, dental, and more. Most plans include Part D and extra benefits. Some plans also include lower out-of-pocket costs. It also shows the picture here, just as in original Medicare, Part A and Part B are both checked off, meaning hospital insurance and medical insurance are both covered in those as well. That's Medicare Advantage, also known as Part C. The bottom here it says, see Section 4, which starts on page 55 to learn more about Medicare Advantage. At a glance, original Medicare versus Medicare Advantage. Doctor and hospital choice. Original Medicare. You can go to any doctor or hospital that takes Medicare anywhere in the U.S. In most cases, you don't need a referral to see a specialist. Costs. So that first one that I read was doctor and hospital choice. And the difference between original Medicare versus Medicare Advantage. That's original Medicare, pertaining doctor and hospital choice. You can go to any doctor or hospital that takes Medicare anywhere in the United States, the US. In most cases, you don't need a referral to see a specialist. Costs. Original Medicare. For Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. You pay a premium, a monthly payment for Part B. If you choose to buy prescription drug coverage, Part D, you'll pay that premium separately. Also under Original Medicare, or covered under Original Medicare, there's no yearly limit on what you pay out of pocket unless you have supplemental coverage, like a Medigap policy. You can get supplemental coverage like a Medigap policy to help pay your remaining out-of-pocket costs, like your 20% coinsurance. Or you can use coverage from a former employer or union or Medicaid. Next part here, next section, Medicare Advantage. This is comparing and contrasting Medicare, original Medicare with Medicare Advantage. In most cases, for Medicare Advantage, you'll need to use doctors who are in the plan's networks. For non-emergency or non-urgent care, ask your doctor if they participate in any Medicare Advantage plans. You may need to get a referral to see a specialist. Medicare Advantage. Out-of-pocket costs vary. Plans may have lower out-of-pocket costs for certain services. You may pay a premium for the plan in addition to a monthly premium for Part B. Most include prescription drug coverage. Plans may have a zero premium or may help pay all or part of your Part B premiums. Plans have a yearly limit on what you pay out of pocket for Medicare Part A and B covered services. Once you reach your plan's limit, you'll pay nothing for Part A and Part B covered services for the rest of the year. You can't buy or use separate supplemental coverage. That's all under Medicare Advantage. That second part where I read out-of-pocket costs vary is under the costs. The cost for Medicare Advantage. For visual learners, it's all there. Page 8, coverage. Original Medicare. Original Medicare covers most medically necessary services and supplies in hospitals, doctor's offices, and other healthcare settings. So that's what it covers directly from the book on page 8. You can join a separate Medicare prescription drug plan, Part D, to get drug coverage. In most cases, you don't have to get a service or supply approved ahead of time for it to be covered. Travel under Original Medicare as well. Original Medicare generally doesn't cover care outside the U.S. You may be able to buy a Medigap policy that covers care outside the U.S. The next part, Medicare Advantage. Medicare Advantage. Plans must cover all of the medically necessary services that Original Medicare covers. Most plans may offer extra benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. Plans can now cover more of these benefits than they have in the past. See page 56. Prescription drug coverage is included in most plans. In some cases, you have to get a service or supply approved ahead of time for it to be covered by the plan. Medicare Advantage. Plans generally don't cover care outside the U.S. Also, plans usually don't cover non-emergency care you get outside your plan's network. These topics are explained in more detail throughout this book. Original Medicare. See Section 3, starting on page 51. Medicare Advantage. See Section 4, starting on page 55. Prescription Drug Coverage Part D. See Section 6, starting on page 73. Look for the, this looks like the measuring of two different weights throughout this book to see comparisons between Original Medicare and Medicare Advantage. I don't know that symbol, but that's that one here. Get the most out of Medicare. Get help choosing the coverage option that's right for you. Get free personalized counseling from your state health insurance assistance program, SHIP. See the back cover for the phone number. This is on page 9. Get the most out of Medicare. Call 1-800-MEDICARE, 1-800-633-4227. TTY users can call 1-877-486-2048. Visit the Medicare Plan Finder at medicare.gov/plan-compare. Get the most value out of your health care. We want to make sure that you have the information you need to make the best decisions about your health care. It's a best interest. This includes giving you access to cost and quality information up front, so you can compare and choose the providers and services that give you the most value. Look for the magnifying glass throughout this book to learn about the different ways to shop for your health care. Get free help with your Medicare questions. For general Medicare questions, visit medicare.gov or call 1-800-MEDICARE. See pages 101 through 108 to learn about other resources. Get preventative services. Ask your doctor or healthcare provider which preventative services like screenings, shots, or vaccines and yearly wellness visits you need to get. Medicare covers many common preventative services at no cost to you. See pages 30 through 49 and look for the apple to learn more. Get help paying for health care. Find out if you can get help paying for your health and prescription drug costs. Go to Section 7, which starts on page 83, to see if you may qualify. There's the apple right there, and there's the magnifying glass right there. Get help paying for health care. And I just read that, I'll read it again. Find out if you can get help paying for your health and prescription drug costs. Go to Section 7, which starts on page 83, to see if you may qualify. Go paperless. To save tax dollars and paper by switching to the electronic version of this handbook, you'll stop getting a paper copy each fall. Visit medicare.gov/go paperless or log into your mymedicare.gov account to switch to the electronic handbook. See page 101 for details. This is the index of topics, and I'll go ahead and end it right there before I read section 2. This is on page 10. Under A, we have abdominal aortic aneurysm. That's on page 30. ABN, see Advanced Beneficiary Notice of Non-Coverage. Accountable Care Organizations, ACOs, that's 106, page 106. Acupuncture, page 49. Advanced Care Planning, page 30. Advanced Beneficiary Notice of Non-Coverage, ABN, page 93. Advantage Plan, see Medicare Advantage Plan. Alcohol Misuse Screening and Counseling, page 30. ALS, see amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. Alzheimer's disease, page 49. Ambulance services, page 31, 48, and 48. Page 31 is in bold. 48 is not in bold. Amyotrophic lateral sclerosis, ALS, is page 15. Appeal, page 60. Page 80, in bold, page 90 through 93, and page 102. Artificial limbs, page 44. Assignment, in bold, page 53, and page 109. Under B, balance exam, that's page 39. Barium enema, page 35. Behavioral health integration services, that's page 31. Beneficiary and family-centered care, quality improvement organizations, BFCC-QIOs, page 107. Benefit period, page 27 through page 28. In bold, page 109. That's 109 for a benefit period. Bills, page 23 through 24. In bold, page 52 through 53, and page 91. Blood, page 26, 30, and 32. Blue button, page 97. In bold, 103. Blue button 2.0. 2, that's page 2, page 53, and page 103. Bone mass measurement, that's bone density, page 32. Braces, arm, leg, back, and neck, that's page 44. Breast exam, clinical, that's page 33. C, cardiac rehabilitation, that's page 32. Under C as well as cardiovascular disease, behavioral therapy, that's page 32. Cardiovascular screenings, page 33. Cataract, page 38. Catastrophic coverage, page 77. Chemotherapy, in bold, page 33 and page 59. Chiropractic services, page 33. Chronic care management services, page 34. Claims, in bold, page 53, page 97, and 103. Clinical nurse specialists, in bold, page 37 and 42. Clinical research studies, page 27, in bold, page 34 and 56. COBRA, page 18 and page 81. Cognitive impairment assessment, page 49. Colonoscopy, that's page 35. Colorectal cancer screenings, that's page 34. Consolidated Omnibus Budget Reconciliation Act, see COBRA. That's what COBRA stands for. Coordination of benefits, page 21. In bold, it's page 107. Cosmetic surgery, page 49. Cost plan, see Medicare cost plans. Costs, co-payments, co-insurance, deductibles, and premiums. Extra help paying for Part D, that's page 83 through page 85. Help with Part A and Part B costs, that's page 86 through 87. Medicare Advantage plans, that's page 59. Original Medicare, page 52 through 53. Part A and Part B, in bold, page 21 through 24, 26 through 49. Coverage determination, Part D, page 91 through 92. Covered services, Part A and Part B, 25 through 49. Credible prescription drug coverage, it's page 73, 75, 77 through 79, 81, 85, 113. In bold is 113. That's for credible prescription drug coverage. Custodial care, page 25, 50, and in bold, page 110. Defibrillator, that's D under D now. Implantable automatic defibrillator, page 35. Definitions, which we read earlier in the first video, 109 through 112. Dementia, in bold, page 34, 49, and 64. Demonstrations / pilot programs, in bold, page 68 and page 87. Dental care and dentures, 49, in bold, and 69. Department of Defense, page 108. Department of Health and Human Services, see Office for Civil Rights. Department of Veteran Affairs, page 77. In bold, page 82. 108. Depression, page 31. In bold, page 36 and 42. Diabetes, page 34. 36 through 37. In bold, that's 36 through 37 for diabetes. Page 41 and page 64. Dialysis, that's kidney dialysis. Page 16 in bold, page 41, 46, 57, 59, 64, and page 102. That's page 102. Disability, in bold, page 15 through 18, page 20, page 86, page 88, page 99. DNA testing, cancer screening, page 34. DME, see durable medical equipment. Drug plan, costs, page 75 through page 79. Enrollment, page 74 through page 75. Types of plans, page 73 through 74. What's covered, page 79 through page 80. Drugs, outpatient, page 43. Durable medical equipment like walkers, page 29, and in bold, page 37. EHR, that's C, electronic health record is what that stands for, EHR. Also under E, EKG or ECG. In bold, that's page 38, and then page 46. Electrocardiogram, see EKG or ECG. Electronic Handbook, that's page 101. Electronic Health Record, EHR, that's page 105. Electronic Medicare Summary, that's lowercase e, capital MSN, page 53, that's in bold, and not in bold, page 102 or 102. Electronic prescribing, that's page 105, 105. Emergency Department Services, page 38. Employer Group Health Plan Coverage. Under Employer Group Health Plan Coverage, we have how it works with Medicare, that's page 21 and page 20, or 20 through 21. Medicare Advantage Plan, Part C, that's page 58. Medigap Open Enrollment, page 71. Prescription drug coverage, in bold, that's page 74, page 78, and page 81. EMSN, see Electronic Medicare Summary. End-stage renal disease, that's ESRD, page 16 through 17, that's in bold, page 41, and page 57 through 59, page 64, and page 68. Enroll, that's Part A, 15 through 18, Part B, 15 through 21, Part C, 65 through 66. Part D, 74 through 75. That's page 74 through page 75. ESRD, see end-stage renal disease. Exception, Part D, that's page 79 in bold, and then 91, page 91 not in bold for exceptions, Part D. Extra benefits, Medicare Advantage, page 8 and page 56 in bold. Extra help, help paying Medicare drug costs, page 66, page 76 in bold, page 83 through 85. That's 83 through 85 is in bold under extra help. Page 107, 107, and page 114 all pertain to extra help. Eyeglasses, page 38. F, under F, we have fecal occult blood test. That's page 35. Federal Employee Health Benefits, FEHB program. That's in bold, page 82, page 108. Federally Qualified Health Center Services, page 35 and page 46. FEHB, see Federal Employee Health Benefits Program. Flexible sigmoidoscopy, that's page 35. Flu shot, page 38. Foot exam, page 38. Form 1095B, page 21. Formulary, page 75, page 79, 91, and 110. Fraud, page 79, 97 through 98. G, general enrollment period, in bold, page 18, page 22, page 65, page 74. Glaucoma test, page 70, page 39. H, health insurance marketplace, that's page 19. Health maintenance organization, HMO, that's page 61. Health risk assessment, that's page 49. Health savings account, that's page 19. Hearing aids, page 39. In bold, page 49 and page 69. Hepatitis B shot, page 39. Hepatitis C screening, it's page 40. HIV screening, page 40. HMO, see Health Maintenance Organization. Home Health Care, page 26 through page 25 through page 26. In bold, page 40 and page 92. That's under Home Health Care. Hospice Care, page 25, page 26 through 27, page 56, page 92. Hospital care, inpatient coverage, page 27 through page 28. HSA, see Health Savings Account, and that's on page 12. I, identity theft, page 97. Indian Health Service, page 77 and page 82. 82 is in bold. Initial enrollment period, in bold, page 17, page 65, page 74. Inpatient, page 27 through 28. Institution, page 64. Under J, that's join. Medicare drug plan, page 74 through 75. Medicare health plan, page 57 through 58. Under K, that's kidney dialysis, page 16, page in bold, page 41, page 46, page 57, 59, 64, and page 102, 102. Kidney disease education services, page 41. Kidney transplant, page 16, page 41, page 47. Page 47 is in bold, and page 59. Under L, we have laboratory services, page 41. Late enrollment penalty, see penalty. Lifetime reserve days, page 27, and page 110. 110 is in bold under lifetime reserve days. Limited income, that's on page 83 through page 88. Long-term care, that's on page 49 and in bold, page 50. Low income subsidy, LIS, see extra help. Lung cancer screening, that's on page 41. Under M, you have mammogram, that's on page 32. Marketplace, see health insurance marketplace. Medicaid, that's page 50, page 68, page 84, page 87. Page 87 is in bold. Medical equipment, see durable medical equipment. Medical nutrition therapy, that's on page 41. Medical savings account, MSA plans, 19, and in bold, medical savings account MSA is also on page 55, that's in bold. Medicare, Part A is page 15 through 18, and in bold, 25 through 28. Part B, 15 through 21, and that's 29 through 49. 29 through 49 is in bold for Part B, where you can find it. Part C, where you can find that, is on page 55 through page 68. Part D, where you can find that, is page 73 through 82. Those are in bold. Medicare Administrative Contractor, that's on page 91. Medicare Advantage Open Enrollment Period, that's on page 4, page 65, and page 74. Page 65 is in bold. Medicare Advantage Plan, how they work with other coverage, page 58. Plan types, 61 through page 64. Star ratings, in bold, 104 through 105. Medicare authorization to disclose personal health information, that's on page 95. Medicare beneficiary ombudsman, that's on page 98. Medicare cost plans, that's on page 67, that's in bold. 73, it's also on page 73, and also on page 76, that's Medicare cost plans. Medicare drug integrity contractor, Medic, that's on page 79, and also on page 98. Medicare.gov, it's on page 102. Medicare Medicaid plans, it's on page 87. Medicare prescription drug coverage, see prescription drug coverage, that's Part D. Medicare savings programs, that's on page 86 through page 87. Medicare summary notice, MSN, that's in bold, page 52 through page 53, in bold. Also, Medicare summary notice, MSN, is also on page 91 and page 97 of the Medicare and You Handbook, the official U.S. government Medicare Handbook for the year 2020. This year. Medicare Supplement Insurance, or otherwise known as Medigap, it's page 51, page 58, and in bold, that's on page 69 through 72, and also on page 81. Medication Therapy Management Program, that's on page 80. Medigap CE, Medicare Supplement Insurance for Medigap. Mental health care, it's on page 27, and in bold on page 42. MSA, see Medical Savings Account Plans. MSN, see Medicare Summary Notice. MyMedicare.gov, page 53, page 97, and in bold, page 103. N, under N we have Nurse Practitioner, that's page 37. Nursing Home, in bold, page 26, page 50, page 64, page 68, page 69, page 84, page 87, and page 102. That's all where you can find nursing home information. Nutrition Therapy Services. C, Medical Nutrition Therapy. I have O. I'll go ahead and read O through Z and section 2 in the next video, because this video is already at